Okay, I'm going to take some vital signs. Before I enter the patient room, I'm going to verify the physician order. I'm going to assess the patient for specific individual needs. I'm going to gather all of my materials, make sure I have them ready. And then I'm going to review the procedures I will be doing in the appropriate reference manual. Once all that is done, I'm going to enter the patient room. I'm going to knock. I'm going to perform hand hygiene. I'm going to introduce myself. Hi, my name's Frank. I'll be your student nurse today. Can you tell me your name and date of birth?
Karen Kosho, 3/1/66.
Okay, perfect. Now that I've verified identity, I'm going to provide privacy. I'm going to explain today I'm just going to take some vitals. I'm going to do blood pressure, pulse ox, temperature. Is that all right?
Yes.
Do you have any questions?
I do not.
Okay, perfect. Now that that's out of the way, I'm going to get started. I'm going to start with the temperature. I'm going to take my probe. I'm going to sanitize it, and I'm just going to run this across your forehead. I'm going to turn it on and wait for it to be ready. And then I'm going to wait for it to beep. It'll be right in your ear when it does. Okay, 98.5, perfect temperature. I'm gonna turn this off and sanitize it again. Okay, now if it's all right, is your right arm okay for blood pressure?
Yes.
Okay, perfect. I'm going to do the first step of a two-step blood pressure. So I'm gonna put the cuff on. And once I get this on, I'm gonna make sure it's snug, and then I'm gonna have you relax. Keep this on the pillow at heart level, and I'm gonna have you uncross your legs and put them flat on the floor. Thank you. And then, have you just been sitting here in this chair the last several minutes, not up and moving around exercising?
Nope.
Okay, perfect. So now that the cuff is on properly, I'm going to get everything situated, and then I'm going to palpate the brachial artery for to estimate the systolic blood pressure. I'm just gonna inflate the cuff, you'll feel a squeeze. All right. The estimated systolic blood pressure is 108, so I'm just going to give it a minute. I'm gonna leave the cuff on if that's okay, and I'm gonna pop this pulse ox on your finger. I'm gonna make sure it's sanitized. I'll use your index finger. Okay. And then I'm just gonna feel your radial pulse so I can make sure that this is accurate. And actually, I'll use your other hand if that's okay. Thank you. I'm struggling. I'm actually gonna try this hand because I'm having some trouble with that one. Oh boy, I lied. I'm gonna go back to this hand. Okay, so the pulse ox is reading 71. For your peripheral pulses, I got 68 and 12 breaths per minute, and your SpO2 is 96. So I'm just gonna turn this off. Okay, and I'll sanitize this. And it's been over a minute since I did the first step of the blood pressure, so I'm gonna make sure the cuff is still on right, and then I am going to estimate the blood pressure. Not estimate, I'm going to take the blood pressure. There's some dogs in this nursing home right now. Okay. I got 102/68. Is that pretty close to your usual baseline?
Yes.
Okay, perfect. I'm going to take this off. All right. So that is all the things that I need to do today, or all the tasks I have for you. I'm going to remove privacy. Are you comfortable right now? Is there anything I can bring you?
Nope, I'm good, thank you.
Okay, perfect. I'm gonna make sure the room is nice. I'm going to gather up all of my equipment. I'm gonna perform hand hygiene, and once I leave the room, I'm going to look back one final time, make sure I didn't leave anything behind, make sure the patient is comfortable, the bed is in the lowest setting. And then once I've left, I'm gonna make sure I perform my hand hygiene, and then I'm gonna document the procedure appropriately.